It's Catherine from Microbalance, and we're live here with Krista Kill from Somas Under Wellness. And we're going to be diving into the topic of mold and mycotoxin exposure and mental health. And so Krista is an integrative health practitioner who practices in the belief that the body was designed to heal given the proper tools. She's been practicing integrative medicine for 5 years in her private practice and specializes in facilitating healing in cases of mystery and complex illnesses, as well as health optimization. And so, hi, Krista. Thanks for joining us. I guess, and also before we begin, I have to say that everything we discussed today is, it's not supposed to be medical advice, and it's not to be used to diagnose or treat any illness or disease. So welcome, everybody. Thanks for joining us. Welcome, Krista. Thanks for taking time out of your busy
schedule. You. Absolutely. I'm so happy to be here with you, Catherine.
Okay, so I think let's start. So Krista wrote an article for our site, Sinusitis Wellness, about mycotoxins and mental health, and we'll link to that in the caption and notes after today. But where that article starts, and where I think is a good place to start, is how mold and mycotoxin exposure could affect someone's brain to the point where they have mental health symptoms and their mental health begins to suffer. So do you kind of get into that for us?
Start there.
Yeah,
absolutely. Yeah. So there's really two main pathways that we could be working with. One is going to be through inhaled mycotoxins vaporizing up into the Neuro system. So especially with chronic cases, there's a lot of times fungal colonies in the sinuses that will emit mycotoxins. So even after somebody's removed from the environment, if they have those colonies sitting there, they're still emitting mycotoxins that can very easily vaporize up past the blood-brain barrier and into the HPA axis and start to dysregulate the neuroendocrine system, the immune system. There's also the leaky gut pathway. So many foods are contaminated with mycotoxins. If we're consuming those and we've got, a poor gut barrier, that may be leaking out into the bloodstream and then causing leaky brain. So again, crossing a blood-brain barrier. And so those are like the two main ones that we're working with. But more often than not, it is the sinus pathway that's leading up to the vaporized mycotoxins.
Okay. Well, that's really interesting. And can you kind of talk about the HPA axis a little bit, sort of the whole inflammatory cascade that goes with that? And because I think some people don't fully understand. They understand it from a standpoint of like adrenal fatigue, or sort of like what they know is adrenal fatigue, but why that has anything to do with mold and mycotoxins might be helpful for some people to understand.
Absolutely. So we are, for the most part, very familiar with adrenal fatigue. The activity of the adrenal glands is controlled from the top down. So HPA axis stands for hypothalamic pituitary adrenal axis. And so that hypothalamus and pituitary is your hormone signaling. And one of those signaling processes includes signaling the adrenal glands on the release of cortisol. So when we've got an input of stress, a lot of folks think that adrenal fatigue is around some sort of emotional stress or too much physical exertion, right? Like over-exercise, dehydration, things like that, or a really emotionally stressful time period. But when we're talking stress, these inputs can be, they can be physical exertion, but they can also be infections, they could be toxins, including mycotoxins. Mm-hmm. And so the relationship between the neuroendocrine system, which is HPA axis, right, the brain's communication to the rest of the hormone cascade, and the immune system are very connected because the immune system responds to cortisol release. So if there's an overabundance of this cortisol releasing from the adrenal glands because of this stress to that HPA axis, we're having a lot of interleukin 1 beta come on the scene, which is a pro-inflammatory cytokine. And it's really good in small doses, right? A little bit of inflammation upon an injury or an acute viral infection, right? It's there for a reason. It's protective, it's healing, and then it dissipates. But when the input of stress is chronic, now we've got chronic inflammation. And so when this continues on, we've got now an imbalance between our stress hormones and our feel-good hormones. So I know we mentioned in the Instagram slide post yesterday about a group of hormones called catecholamines, and these are our stress hormones. When you have something like mycotoxins continually inputting that stress signal, we're going to have too many catecholamines, your stress hormones, your norepinephrine, your cortisol. And a lot of times there's too much of it released. And with that additional toxic burden, we don't have the methylation pathways opened up to digest and break those down. In addition to that, the feel-good neurotransmitters, your dopamine, a lot of times your serotonin, melatonin get a little bit out of whack as well. Your feel-good neurotransmitters drop. And so now we have this overabundant stress signal and then not enough of that feel-good, which can obviously lead us to many different presentations of mental health.
Okay. Well, I mean, that's kind of where I was going to go next and talk about, so what are some of the health symptoms, I guess, the mental health symptoms that somebody experiencing this would display, and maybe even more, what would be different between, typical display of something like maybe depression or anxiety versus those symptoms brought on by mold specifically?
Absolutely. Yeah. Great question. So the first piece of that, it can really present as all sorts of mental health conditions. I do see anxiety, depression, PANS, PANDAS, and binge eating disorder actually most commonly with mycotoxins. It can go as far as, addiction. It can go into obsessive compulsive disorder. We can have a lot of different bipolar disorder. We can have a lot of things going on here because it's all running on those similar pathways. So it is tricky to tell the difference between a mental health condition brought on by mold versus, something else, potentially another infection or, poor methylation or acute stressors in your life. But what I've noticed is a pretty good sign that it might be mycotoxins. And this is confusing for a lot of folks because they think I'm just relaxed, so I feel better. But sometimes when somebody goes on vacation and they feel a lot better, physically, emotionally, they think they're just relaxed, but they're actually getting out of maybe their moldy home or their moldy apartment.
Yeah.
And so that can be a really good sign that it may be environmental. Even when if somebody's in a working environment that's moldy, a week off, they're thinking, oh, I'm just less stressed, but they're also, coming out of that moldy environment. And then a lot of the characteristics of mental health related to mycotoxins has to do with the brain's pleasure response. So that's that GABA pathway. And common mycotoxins, including one of the most common ones that comes in on food, deoxynilabanol, will influence this GABA pathway. So that presents as changes to one's motivation, their experience of pleasure, how much they're seeking that dopamine hit, and again, that depletion of neurotransmitters, those feel-good hormones, which can go into so many different presentations, including, your sleep and your will to get up and get going in the morning.
Yeah. And I mean, reading your article, I found it particularly interesting that you pinpointed disordered eating behaviors, because I think even in my own experience with mold, I think that is such an under talked about and appreciated symptom of mold. Just for me, it was just like a complete and utter discomfort in my body that I had never experienced before. And I had a lot of like food aversions almost from a sensory place. But I don't know if you want to talk a little bit more about the binge eating. I know we've got like someone who's joined us said that, she totally relates because she's experiences this. So I just thought that was something that you had like a very unique insight into.
Absolutely. Yeah, I would love to talk about that. That's something that I experienced a lot too. And so it got me curious because I was noticing as I was healing, when I would have flare-ups with my physical symptoms, my emotional eating symptoms would derail as well. And so it got me curious because it felt very physiological once I got familiar with the patterns. And so mold's a tricky one with that because it does interplay into something like binge eating disorder in a very specific way. So number one, we've got this dopamine depletion, right? We're seeking comfort, we're seeking pleasure because we're not experiencing enough of it. And so obviously, food does that to our brains. We see that in labs. We know that as, our experience of food and gathering around a table, but it's feeding that dopamine pathway. The other elements of something like binge eating disorder is mycotoxins behave like an obesogen in the body. And so a lot of times if we have stubborn, weight that won't come off, or we're gaining weight, we're blaming it on the binge eating. And some of it may be, but some of it may also be the obesogenic property of the mycotoxin inflaming your body and not allowing you to release weight. And it affects your leptin and ghrelin receptors, which is your hunger and fullness, right? So you're not having the fullness cues come on the scene. Instead, you've had enough, because that's what that obesogenic property of mold does to your cells, is it kind of shuts off that natural process. And it can be very challenging for especially folks seeking that conventional, maybe binge eating treatment, because they don't feel like they can trust themselves. They're not having those cues naturally come on the scene. And it can make healing from something like that a little bit more complex.
Mm-hmm. And I mean, do you see in your practice that a lot of the people coming to you find you because they've been treatment, and I hate the word resistant because that implies that it's something wrong with the person,
Sure.
but they've just not been responding to typical mental health treatment where, maybe it's, medications, maybe it's like talk therapy. They just sort of are at the end of their rope and think integrative health. I haven't tried that yet.
Absolutely. Yeah. Sometimes I get folks that are kind of coming in with a slew of things, and the mental health aspect is like, the cherry on top, where of course, mental health isn't where it's, at its peak. They're feeling so sick for so long. But I do have a pretty significant population that will just come in with persistent mental health symptoms. A lot of times this is OCD, bipolar, anxiety, and depression. And so a lot of times these folks have gotten used to the adaptations that their brain has made in response to having this toxin long live in the body. And so maybe talk therapy has been tried. I've had a couple cases where we actually, with the success of treating the mycotoxin, the medication for anxiety or depression has had to titrate down because they're doing so well. And so that shows you that direct relationship between those two things. Absolutely. It can really masquerade around as, neuroinflammation, that brain on fire feeling. And a lot of times that presents as mental health symptoms.
Okay. Well, and then it might also be a good time to talk about, I know you do neurofeedback in your practice. And so on your patients that are dealing with mold, do you see certain things about their brain and sort of the way their brain responds maybe you want to explain neurofeedback to some of the people joining, because it might not make sense, but it's kind of sort of a way of looking at your brain and how it reacts to things that's a little bit different than what most people have been familiar with.
Absolutely. So it's similar to neurofeedback. I use bioresonance testing, which is a frequency-based technology, but I can look at, the individual nerves, the cranial nerves, the different cortexes of the brain, the vagus nerve, the blood flow to the brain. And a lot of times in folks that come in with mental health symptoms, the blood that's flowing through the brain and, especially into the vagus nerve is full of mycotoxins. And so sometimes, taking that one step deeper and thinking, what's systemic is our blood, it's going everywhere. Mm-hmm. That's a good way to, detect some of those things. I do find often that they will present with pathology of inflammation of their brain. And so that's obviously not surprising. And then the technology actually can also read certain mental health conditions. It can bring up some of those pathologies of OCD and even schizophrenia and things like that. So it is pretty interesting that it will definitely line up with the cases that come in and, again, that brain on fire mentality or analogy rather, it will be pretty good at detecting that. But I find that blood of the blood-brain barrier is a good place to find sneaky mycotoxins.
Okay. Well, and just, I guess I'll keep us moving along. So in your article, you have a case study on a patient that came in and sort of like how you pinpointed the mold. And I thought that might be helpful to share, so that maybe somebody listening might kind of see what's going on with themselves. And
Sure. Absolutely. Yeah. So this person came in. I do 2 types of testing in office during the initial evaluation. And one of them is that bioresonance testing. And so I'm gathering common themes, things I'm seeing across some systems of the body. And mycotoxins were repetitively coming up for this case. And then I do a form of applied kinesiology called bioemissions testing, or CPK. And that will organize the information into this order of operations, more or less. And so I was getting a lot of signal for mycotoxins, a lot of priority around the HPA axis and the sinuses for this person. And so, I sent this person home with the EC3 plates, and I said, lay them around your house. Here's how to do it the best way. Collected it. I also nasal swabbed her during the appointment, right, to test for colonies in the sinuses. And within the first few weeks, she had those plates done, and we found a local problem. And this is like best case scenario for somebody who's, got mold somewhere in their home, is for it to be this isolated area where maybe there's a leak or something and it hasn't ruined, the walls and the whole house.
yeah.
So, we found a little bit of a spot, mostly in the crawl space of the foyer, and, worked with a reputable mold remediation company. They were able to come in with the information that she said, because not all the time do they check, all of these places that mold might be hiding. And so this person was able to direct the remediation team, hey, this is where we found the problem. And they went right back there, they removed it, they treated it. And, she continued on with the protocol. Obviously, we've got to get the mold out of the body, not only out of the house.
Mm-hmm.
And this person did really well with stabilizing her mood, stabilizing the focus and the mental health and the sleep. And when asked how long that anxiety had been something that was a part of this person's life, it was as long as she could remember. And so, this may have been a childhood home that got things started, or, a genetic predisposition. We don't know for certain, but I do know that if you get the internal and the external environments cleaned up and lined up, that good things happen.
Yeah. I mean, and it's, just like, even in the opposite, it's really hard to treat someone's body if, like the environmental onslaught continues. So
100%.
I guess it is best case when you've got a patient who's like so willing to
yeah so bring them in and do the work right away. That's a huge roadblock for people. And I think even more so in a case of mental health or chronic fatigue, where there's this just energetic barrier to taking action, obviously, right? You don't feel like doing anything when you don't feel good. It can be really hard to change that environment, but it's so important, because we could throw all the best supplements at you in the world, the best nutrition, right? Best diet. But if you're still in the environment that made you sick, it's going to be really difficult to make good progress.
Yeah. And I mean, and I think that's also, and you mentioned this in your article too, like that's also sort of a piece of the mental health puzzle where, you've got the layer of someone dealing with the mental health repercussions of being chronically ill,
Mm-hmm.
and then with the actual mental health symptoms that might be anxiety and other things that are being caused by the mycotoxins. So it's sort of like a double whammy.
Yeah.
Okay. So I guess I think another place to go for everyone who's joining us are things that are particularly helpful that people can do. I mean, anyone can do to sort of help themselves, sort of, I guess, from a baseline perspective. I mean, obviously there is working with someone like you, and we'll include all of our contact information for everybody joining us, but maybe even a place to start for someone to take mold off the table, to see if, maybe even the peace of mind that it's not mold,
Absolutely. Yeah, that is a great place to start, is a process of elimination, right? Rule it out. And the best way to do that always is to test. using, as I mentioned, the EC3 plates. I've got them right here, so I'm looking over on my desk. But using the EC3 plates to rule it out in your home, but then also, maybe doing a nasal swab or a urine mycotoxin test to rule it out in your body. Even testing for, HLA-DR genes, things that set you up for not being able to detoxify biotoxins like mold easily. Another really simple one that I use with cases that are starting out is the visual contrast test. It's $15 and it gives you really good information, and it's a good benchmark rather than doing maybe something like a urine mycotoxin test every 3 months where, it's maybe a little bit more of a financial investment. As wonderful a test as it is, and I love it, doing that visual contrast test can give you really good bits of information, especially as we're starting to see improvement on seeing the percentage of the susceptibility to biotoxin illness to, improve, obviously, especially with somebody for neurological symptoms. So definitely test your home, test your body, and work with somebody, work with a provider, because like we mentioned, the will to get started, especially when you have symptoms of neuroinflammation and mental health presentations, can be really hard. So it's important to have somebody that you trust to keep you on the path to wellness and to get you better. So that's a great place to start if you've done nothing yet. I know we had a little section in the article about situational mental health stress. And, when you've been super sick for a long time and maybe you've had to do mold avoidance. I know this was something that I needed to do, as a 3-month strict mold avoidance, trying not to get exposed. And it was very difficult, but it absolutely helped. And that is really to give your immune system a break from the constant battle that it's fighting, right? So you want to give it a break so that you can actually retrain it to respond in a different way, especially in cases like mast cell activation or chronic inflammatory response syndrome. Those are 2 big ones, right? So when you're starting to get out and about again, we want to have tools in our toolbox, because we might be feeling anxious about getting exposed at a restaurant, jumping in somebody else's car that might, their filters might need to be changed and you're getting moldy air blown on you in the car. These are small things that, we don't always think about that may be, irritants and to our symptoms, are causing some of that situational anxiety. And so we can control the controllables. And I've got a few things. I don't know if you want me to kind of go into some of those things that we listed in the article.
Yeah, I think that would be really helpful. Obviously the article is available for anybody to read, but we can go through a couple of those, and then we're getting some really great questions. We can kind of try to tackle some of those. So go right up. Yeah.
Perfect.
You have a good list there. So I think that like all of them are helpful and accessible.
Awesome. Yeah. Great. So the first one's nasal irrigation. And honestly, my favorite kit is yours, like the Microbalance Health Kit. The Citrodrops Nasal Rinse Bundle is fantastic. I think doing that before a potential or known exposure and or immediately after, the idea is we want to keep that gateway as clean as possible. We don't want the mycotoxins sitting there for longer than necessary. And so even when you're traveling, like I'll travel through the airport with my NasoPure bottle, and I'll rinse before I get on the plane and after I get off the plane, because a lot of times by the time you're sitting there and you're getting to your destination, they've been sitting there so long, maybe you get off the plane with bloodshot eyes, a headache, fatigue, right? So keeping that area clean is really good. We have a mention about including binders in the rinse as a way to pull out any spores that have gotten in. And then binding agents orally, so taking something like bioactive binder, activated charcoal, something like that will pull them out of the body orally, that you can take around an exposure as well, is really good. Obviously, binders are going to be a foundational starting point for anybody dealing with mycotoxin as well. You definitely want to make sure that's a part of your protocol. Personal air purifiers are great if you're traveling. Take it with you. They also make lanyards that are pretty cool, so you can just wear it. That's especially good for kids. Kids even going to school in a moldy school, they can wear the lanyard around them, or they can just plop the personal purifier on the desk. That's a great way to mitigate some of the mycotoxins circulating around the area. It's not perfect, but it's definitely better than nothing. And then brain retraining is a great one. So especially if you do have that emotional response to the idea of getting exposed, the idea of going out to a new place, we want to make sure that your body and your mind are on the same page and they're working together. We're making sure that the adaptation that has been created to deal with the mycotoxins is now going to be on a new path, and we're not stuck in that neuro pathway, but we're actually creating a new one that says my immune system is healthy and strong enough to handle this. And then lastly was retraining the neuroendocrine system. I really like homeopathics for this, and this goes along really well in tandem with the brain retraining, because part of that brain retraining and the emotional piece is reprogramming the HPA axis and the rest of the cortexes that make up the limbic system. And we mentioned celltropin as a really great way to do that, as that's what it's designed for, is to, de-escalate the symptoms and the responses to mycotoxin exposure. So those are a few things that we have all listed in that article, but I found them to be very helpful.
Yeah, I mean, homeopathy, we're obviously big fans at Microbalance. I see that Krista's articles link, and Omar, if you click, I saw his question about us talking about the products slower. If you click on the article link, all of the products are listed and linked in that article. So that's a really good resource for that question. But yeah, homeopathics are wonderful in the sense that, similar to brain retraining, they're designed to uproot and, trigger that healing response in the body, which is sort of a deeper level of healing, but they do require sticking with them.
Yeah.
So I think that's sometimes hard for people who want like instant symptom suppression.
Yeah.
But so that's my, I guess, push for that. And obviously at Microbalance, we're really big proponents of addressing the sinuses as sort of the entry point to the body. And like Krista was saying, I think once you start nasal rinsing proactively, you'll never stop, because you truly see that if you just jump all over it, you can almost stop symptoms of exposure like in their tracks, and you really won't have that like 2 days of sickness that you may have had previously from walking into a moldy building and not doing that. So okay, well, so do you want to tackle some of these questions?
Yeah, let's do it.
Let's see. Any ideas on ways to help open methylation pathways?
Yeah, that's a really good one. We want to test usually for that, right? The most common one when we look at methylation is MTHFR pathway, which can be really supported well for most people by a methyl B12. But there's particularities to that. There's many different ways that we can support depending on what types of methylation pathways are impaired for you. But definitely, if you haven't tried methylated Bs, that may be a good start to, see where we're at with that. If improvements start to come, B12 with folinic acid. I know Seeking Health has a really good one. Some people do great with that folinic acid added to the B12. So if you haven't started that, start that. Otherwise, if you're not seeing improvements with that, I would definitely do some sort of genetic testing to see what you're naturally deficient in. And I've found in stuck cases that doing a genetic test is really good, and getting those foundational materials back into the body so that it can detox, and throwing in some antifungals with that has been pretty successful.
Okay, that's great advice. Okay, is there, Veronica wants to know, is there anything I can take to lessen the emotional eating, binge eating? I'm assuming the GLP-1 medications will not work.
Okay. Yeah, that's a great question. And I'm sorry that you're going through that. It can feel really debilitating and like you're stuck. I would say on any supplements and on the GLP-1, balancing blood sugar can help because it can mitigate cravings, right? So something like berberine is a natural one to do that. Ginseng, American ginseng, is a really good one to balance blood sugar. And making sure you're getting protein, fat, and fiber as the foundation to your meals is great, obviously nutritionally. So that can set the stage for success. And then I would really recommend brain retraining, because a lot of times, we're subconsciously seeking something that we can reparent in brain retraining work, one-on-one with somebody who's, trained in doing something like that, and then rule out, an infection like a mycotoxin or fungal infection in the body that may be driving some of those, like we talked about, the leptin ghrelin receptors and the pleasure pathway of the brain. Rule those out and see how much of it is physiological versus the emotional piece.
Yeah. And there's also, I mean, there are also layers to mold illness that have to do with, like impaired absorption and digestion. And I think, I don't know. I definitely, Veronica, I don't know what you're dealing with, but I think sometimes our bodies crave like what we don't get, and
Yeah.
there's just so many layers to it. You're kind of like in survival mode too. So I would just encourage you to like, don't feel shame or, guilt about it, because sometimes it's like bigger than bigger than just willpower. So,
I can definitely concur with that. I mean that was almost as stressful as some of the physical
mhm.
symptoms in my own journey. So it's tough, but absolutely there's pieces like you talked about, even with the absorption. Sometimes we're craving things that we're not, our cells aren't uptaking because they're too inflamed. So
Mhm.
definitely work on that inflammation response, and then dig into any emotional undercurrents to those symptoms.
Do you do virtual bioresonance testing?
Yes. So if you come to me in office, we use a set of headphones with a receptor in the ear. If you are a virtual client, you send me a DNA hair sample and I put it into the receptor, and it scans it the same way that it would scan the nervous system with the headset on. So, absolutely, a lot of my clients are at a distance.
Oh, that's so cool. I love that. Okay. Omar wants to know, what about ERMI test? Do you recommend it? Is there an alternative you prefer?
I like ERMI testing. I think that's a great next step. The reason I have people start with the plate testing is it's so inexpensive and it gives you great data. So, if you are a homeowner or you're testing a potential home that you're going to buy or stay in for a long time, I do think doing something like an ERMI test is very valuable information, because it's going to tell you what particular species you've got going on and what the levels are. I definitely would recommend doing something beyond disc testing, or traditional air sample testing with an inspector. We need a little bit more information than that, and ERMI is a great way to do that. If you are looking at being in a location that's more long term, I think that's great data.
Mm-hmm. I mean, ERMI is great. I mean, just like any form of testing, um, even with the plates and with the Emma test we also have on our website, those are just a piece of the puzzle. Emma's going to show you your exposure risk, basically in the environment, where the plates are going to kind of be more of a yes or no litmus test
Yeah.
type thing. ERMI is going to give you a picture, but it's not going to tell you if it's current or historical. But all of these things can be pieced together with a great inspector. And another thing, I've personally just gotten really into and discussing with people, and I know our founder, Dr. Dennis, recommends, are the mold dogs. They can be excellent at actually at source location. I mean, that's where they're the strongest. But I mean, there are just so many different ways. There's no right or wrong way. So, like, I think what Krista was saying, and I completely reiterate and think that it's great, is that you've just got to start somewhere. So, and that everything you do is going to lead you closer to the answer.
100%.
Let's see. Um, what is a visual contrast test?
Visual contrast test is it's on your laptop, it's on a computer, but it's essentially reading and measuring the way that your brain is taking information via different patterns and colors with the eyes. So your eyes are obviously, the optic nerve is connected to your brain, and so we're looking at two hemispheres with both sides of the body. So essentially, it's kind of taking you through this short test, and it will give you a percentage to your susceptibility to biotoxin illness, which can include, mold, Lyme, bacteria, things like that. But it's a very simple way to, figure out, do you have an inflamed brain?
And it's contrast acuity, really, isn't it? Isn't it sort of like, seeing like scales of gray, kind of? Okay.
Yeah.
Um, I mean, I took one a long time ago, when in my own mold ordeal. And it's totally non-invasive and very easy.
Very easy.
It's nothing to fear. Let's see. We already got that one. Personal air purifiers. Do you have like a recommendation for one that you like in particular, or one that you've seen used with good effect?
Yeah, I use Medify Air.
Okay.
I use their personal purifier. They don't have the lanyard like I was talking about, but I do think that is your best option, is that mini one from Medify Air. It does a great job. And it's very small, fits in a cup holder, and that's the one I have a lot of my clients use as well.
Okay. And I don't know if they make these anymore, but the Wine, WEIN, have you ever seen those?
No.
They're the lanyards you can wear around your neck. Now, I don't know if they still make them, but I have them for me and my kids, and I think I've had them for 9 years now. So they do last if they still make them. So
I met somebody one time that had a lanyard like that also omitted ozone into the air to clear it up. So I've always wanted to try that because I'm a big fan of ozone for mycotoxin illness. But anyways, that is pretty neat. It's a great for on the go.
I don't know about these. They may. I mean, they're bipolar ionization, so that might emit some ozone. So
very cool.
And let's see. Do you have any cases in which patients, their body feels colder or weaker only on one side?
I have seen this. Sometimes it's more of a multifaceted. Sometimes it's not only solely mold. On the temperature dysregulation, the muscle weakness on one side, we're definitely looking at a neurotoxin in that case. But yeah, I would say you'd want to probably explore some root cause testing for that and see, where the origin is and what pathogen is primarily responsible. Because it could be a few different things going on with that presentation.
Okay. And I know mycotoxins do affect circulation, but I don't know if that is really what he's asking. I think it sounds more like
it sounds like a little bit of both potentially. It sounds a little bit neuro and a little bit vascular. Definitely mold can be involved in that. Heavy metals can also definitely affect circulation, as can Lyme and co-infections. So we've got a couple things that we could be working with there, but I would say, what does the rest of your case history look like? And maybe we can pinpoint, more of a definitive root cause and do some testing around that. But I would definitely look at the brain.
Okay. Is wearing a mask effective? I guess she's asking about to mitigate mold exposure. That's what I'm assuming.
Sure.
I don't know, Ezra, if I'm right or not, but that's what I'm assuming.
Yeah, I would assume that as well. It is effective. Not everybody wants to travel with one on, or, some people feel a little bit claustrophobic, or maybe it's hot outside. This doesn't protect your mouth. However, I do use these myself occasionally when I travel and recommend them to clients. They make a nasal insert. I think I have it in my bag, but it's essentially like a little filter that goes up into the nostrils.
Wow.
It's a clear silicone. I think I have it right here in my bag. It's a clear silicone strip with organic cotton filters, and it lasts for about 6 to 8 hours, and you can't see it. And so it looks like this.
That is so cool.
And so it's obviously not protecting your mouth, but that's not primarily where we're concerned about, the neurotoxin piece anyways. We really want to look at the nose. And so that's a great one. If you've got to travel and sit on a plane for a long time, what I typically do is nasal rinse before I put this in, put it in. And then after I get off the plane, I'll add a little binder to a nasal rinse and rinse again.
Okay. Great tips. Folinic acid, I don't know if I'm saying that right, versus 5-MTHF. I don't know what that is, so I'm going to just let you take that one.
So it's going to be working on different methylation pathways, and some folks need different types of nutrients to facilitate the movement in those pathways. And so they all have their time and place. It's really just a matter of, what partnership of things do you need, right? Like some people need B1 or B6. Some people need a little bit of trimethylglycine. It's all some of these different, materials. And it truly depends on what genetic SNPs you might have, or what epigenetic presentation of poor methylation that you're working with based on, your toxic load.
Okay. And when I try to irrigate my sinuses, it never comes out of the opposite nostril. What do I do?
Oof, yeah, that's tough. I have had a couple clients with like a really, really poor case of deviated septums that cannot nasal rinse. And so I think this is a great sign for you though, Hannah, that something is going on in the sinuses. If it's not a deviated septum, what's blocking, right? Is there a fungal colony blocking the water flow through the nose? Is it structural, right? Kind of seeing an ENT, getting some imaging on that, making sure that, nothing's blocking. Structurally, it may just be that, kind of fungal colonization piece. But whenever, sometimes I have kids that really can't, nasal rinse, or adults with, again, these like really crooked, deviated septums, they can't rinse safely. I'll have them do nasal sprays and then nebulizing, because that's going to be kind of your second best option beyond nasal rinsing to deliver a remedy up into the sinuses, just getting those vapors moving. And who knows, if it is, you may try a little bit of nebulizing antifungals and find that clears up on you, and then you can get that stream flowing again.
Mm-hmm. And I know Dr. Dennis sometimes recommends like facial steaming with like just a little bit of the Citradrops dietary supplement, just like you said, just to kind of get you loosened up to the point where you can rinse.
That's exactly what I have clients put in there. Yep.
Let's see. Can I use the test plates to test my sinuses? That's Hannah again.
You can. It's a good start. If it's deeper than a sterile swab can get to, then I know Dr. Dennis does a lot of CT scanning, I believe, for fungal colonies, and detecting the fungal balls in the sinuses. But yes, doing you want to use a sterile swab, so you're not testing an open air Q-tip.
Yeah.
So get your sterile swab on Amazon. But you'll want to swab up there and then just paint your dish, close it up, label it on top of the fridge for a week, and see what grows.
Yeah. And there's kind of, your nose is a filter. So there is going to be some mold, but it shouldn't be, too numerous to count or anything like that. And that's why working with someone like Krista is great, because she kind of knows from lots of experience what's normal versus what's not. Okay. I don't know the name of this product. What about
I'm actually not familiar with that either. I don't know if that's a particular substance or supplement. I'm kind of looking at it now. Let's see here. Okay. It's a plant for blood sugar regulation. I am not familiar with the benefits of that. I've not used it in practice myself, but I would be interested in learning more about it.
Okay. And then Heidi just joining, how can we contact you?
Absolutely. So I think we're going to have the information below, but best way is to go check out the website and learn a little bit more. And then, book either a consult or just give the office number a call. It's on the website. Happy to answer any questions. You can also just book an appointment right away too, if you're feeling ready to jump in there. But a lot of folks want to, ask a little bit more about the process, and happy to answer those questions on a phone call.
Okay. What do you think about CMS RX to remove mycotoxins?
I am not familiar with that in mycotoxin removal myself.
I don't know what that is either, in terms of like if it's environmental or body.
Sure. I don't use that personally. Like Catherine was mentioning at the beginning, with a traditional neurofeedback scan, that can be really, really helpful, like an EEG, to look at different parts of the brain and if they're shutting down or not. Obviously, with contrast imaging, sometimes we can see different things with the brain that we can't with something like a neurofeedback. But as far as functioning goes on the brain, I'm more inclined to do something like that EEG neurofeedback setup than an MRI.
Okay. Do you ever look at neuroquant brain MRIs to determine mold exposure? So that's sort of keeping with that topic.
Yeah, I would say the same with that. I would rather do a resonance-based test and go a little bit non-invasive to start. But I think for everybody with with your case history, you got to determine what you've tried so far and, where you're feeling pulled to as well. Because I also think you are, your own doctor. And so if you're feeling pulled to try it, I would, explore what that looks like for you. But I do think there are, less invasive ways to get great data.
Mm-hmm. And I mean, I also know from experience, like an EEG, or even a SPECT scan, when you're in the mold can be very alarming.
Yeah.
I don't know that was helpful for me at that time. I mean, obviously it pinpointed some, where I was truly lit up and,
Yeah.
a lot of what looked almost like trauma. So
that's the thing too, is it can be emotional trauma. And I can concur with that. I had a similar experience, like, whoa, one of this cortex of my brain's running at 50%. And it sometimes can be trauma. And so a good interpretation is great. But my own personal philosophy is start a little bit more simple. And if you've tried, you've exhausted all your options, maybe go for something that's, more comprehensive or just different in its nature. And I think that's very good if you're hitting a roadblock. But all in all, I think that you can, really get started on the right track with some less invasive options.
Yeah. And I think what you do is really cool and interesting with the brain retraining, even with neurofeedback, because I was very much pushed towards DNRS, which is excellent. But during that time for me, I was so unable to focus and to, like you said before, like just, a list of tasks was almost too much. So the whole idea of doing DNRS and doing it every day was way too
much.
overwhelming. Yeah.
I do find that to be very true. And that's where I like some of these other techniques where whether we're working one-on-one, doing some of that parts and memory therapy, a little bit of, EFT or NET, things like that can be really good to break foundational patterns. And then we often do ship brain tap headsets out to homes if you're at a distance. If you're, local, you come in the office and sit and do it. But it's a little bit like neurofeedback at home. It has a bit of bilateral stimulation. It's got the light therapy to stimulate and relax parts of the brain. But that could be really helpful in consistent use and healing, inflammation of the brain, post TBI or, inflamed brain from mycotoxin illness is definitely a great technology.
Oh yeah. I mean, and I would wholeheartedly advocate that to anybody in treatment. It was so helpful for me personally. So
Yeah, me too.
Let's see. Where can you order a Marcon's test? Is it advisable?
I think if in certain types of cases, looking at like if you are treatment resistant to some of the nasal rinsing, you're having these problems kind of just snowball and you're not seeing much movement, I think that's a great thing to explore. I believe you can get it off of, I think they have a website. I'm not sure of other vendors that offer it, if I'm going to be totally honest with you, because I don't typically have to go there with clients. Typically, if there are Marcons, it kind of just clears with some of the treatment. But
we can link to an article too below this. I mean, I know how Dr. Dennis feels about Marcons, which is an unpopular opinion. But I mean, Marcon should not be a problem unless you're living and dealing with mold. Yeah.
That's my school of thought too, which is where I really only test for fungus and not, the bacteria in there. But yeah, I'm in agreement on that.
Yeah. And then a lot of times what you're constantly doing to chase the Marcons is creating another layer of issues. So, you don't want to get more like resistant fungus, like as a result.
That's a great point too, because the epithelial lining in the sinuses and the respiratory system is similar to the gut in the way where you have a microbiome diversity essentially of it, right? Different bacteria, fungi, and everything. And so we know that if we have too little good bacteria in the gut, the bad stuff overgrows. And same thing, if you're just constantly wiping and not, reinoculating. I'll even have some people, swab ion, which is a soil-based probiotic at some point in the protocol, and not do too many, too long a sensitive period of time of abrasive antifungals, because like you said, we want some of that diversity because that is also how your immune system protects you and what keeps that epithelial lining healthy.
Yeah, I mean, ion is a wonderful suggestion. Another thing, we do not sell it, but I know it is very helpful for persistent Marcon's patients who have done lots of bag spray and things like that. It's called Lantosinus, I believe, and it's a probiotic powder, sinus powder, for the same reason. It almost helps you re-diversify and repopulate so that you can heal, because nothing should be taking over unless it's being inhaled at an amount that is more than your immune system and body can handle.
Yeah.
And then, let's see. A lot of these aren't really questions. Let's see. Just joined, but how to heal from chemical sensitivity caused by mold. I've been out of mold for a year. I feel better, but I have chemical sensitivity.
That's a great question. I would foundationally go back to the brain and neuroendocrine retraining to help the immune system get out of the habit of responding with high sensitivity. So that's one piece. There may also be things, beyond the mycotoxin piece. A lot of times, metals or parasites can come along with that, and it can drive something like chemical sensitivity to continue on even after you've removed yourself from the moldy environment. So I would say definitely, immune and limbic system retraining, and then just rule out other infections that may be putting your immune system on high alert.
Mm-hmm. I think that's a good point. And do you think that has anything to do with like histamine or MCAS? Okay.
Absolutely. Yeah, it absolutely does. And so, with histamines too, we have the drivers of that Th2 dominant immune response. And most commonly, it's going to be mold fungus or parasitic. And then sometimes metals can come in where it can drive histamines as well. And so if you're dealing with histamine-based issues, you definitely want to look at those three elements mainly. And if you've already addressed the mold, maybe your next step is to look at, heavy metals. Typically, parasites are usually addressed at the beginning stages of healing with, somebody who's practicing functional medicine. But if not, that might be another place to go and see, what's going on in the gut. And it may be a time of rebuilding and repair for you rather than detox and depletion. There may be, it needs to be a little bit of nourishing to those, immune pathways and to the gut as well.
Okay. That's great. I know a lot of people go right to detox with that. So I love hearing that. And let's see. Do you know of doctors or methods that will assist someone in getting off of antidepressants? I had extensive treatment with Dr. Dennis years ago.
Yeah. So I've had clients come to me with that goal in mind. And so obviously, as I'm not a medical doctor, I can't indefinitely encourage you to get off of your medications, right? I'm not really in scope to say that. But if that is your goal and we're working, closely with your prescriber, we can titrate down really safely. And sometimes we don't even have to try necessarily. You're getting better, and as a result, maybe you're seeing, whether it's a psychiatrist or somebody else prescribing you that antidepressant, that you're seeing the need for a decrease in dosage because of how you're feeling. And so I have specifically titrated where sometimes I'll kind of do this effect with an antidepressant herb, like an herb that has the antidepressant properties. And so we'll kind of do this with the medication and the herb and balance it out. So we've got maybe a low dosage of both for a while and just really tip that scale. However, you definitely need to be working with somebody who is knowledgeable in that area, because you don't want to be taking, herbs that are contraindicating with your medication and taking the wrong levels, because then you're going to have, a problem and a negative experience with that titration. So I would say definitely work with somebody, but I am a big proponent of finding like frequency medicine docs to help you with that, because they're going to be able to test the right herb, the right dosage, and follow along with that titration journey. Because if they're not familiar with how to do that, they may just say, well, we need to wait to get you off of those medications completely, and then we can do something natural for it.
Mm-hmm. I mean, and if something is working for you, definitely, just like Krista said, work with someone who can help, because, you know, prescriptions aren't all bad, and it's not terrible to need them if you truly do. So, okay. My industrial hygienist says that Petri dishes are not the most scientific way to assess exposure to molds in the environment. The agar only grows certain molds. Agreed. I think we kind of covered that. I mean, I just think that they're one way to get started. And also, even at Microbalance, we sell the Petri dishes, and I would never tell anyone that you should only use those to test your home. I think they're really a great thing to have, especially if you know you're a mold sensitive person. We use them in our house to kind of monitor things. Because I mean, it really helps too. Like, or, you know, for example, if my mother-in-law is like, do you want this couch? Sometimes I'll just give it a tap test before I decide if we want it. But because I know that it's going to light me up if it has a mold issue. And it, you know, in someone's house it might be fine, but for someone who's really sensitive, it isn't. So, you know, that those are the things that they're really good for. But definitely they're not, you know, if you're at a place where you know you've got a problem, you know you need to remediate, you know you need to pinpoint the source and be very scientific about it, I would never say, oh, just use a 6-pack of test plates to figure that out. So
yeah, I would totally agree with that. You know, they're an easy yes. They're an easy yes to you know, kind of rule it in or out, and that I find is very helpful, especially for renters, right, that are not going to go through a remediation process, and they're not going to want to spend several hundreds of dollars on testing. They're a great tool for that. And then, like you mentioned, Catherine, like keeping it on the radar and just checking and testing upholstered items and things like that can be really, really helpful. And I have found that typical or some Petri dishes are better than other Petri dishes. That's why I do recommend the Microbalance Health, because I've had, you know, done experiments and some pick it up and some don't. So I would definitely agree. It's not, you know, the end point that maybe you want to get to if you are a homeowner, but it's a great tool.
Yeah. And you definitely don't want to buy ones that do both bacteria and mold. Do you just want one or the other, just so you kind of truly understand what you're testing for? You want to do those kind of tests separately if you're going to do both. We kind of recommend that too, because it can kind of be difficult to see what you're being exposed to if you're doing an agar that can grow both. I think, can the Microbalance product eradicate Marcons? I mean, like we've said before, I mean, everyone technically has Marcons in their nose, just like mold. So if you have an infection, because of having decreased immunity or, you know, inhaling a large volume of mold, you're going to have to kind of deal with that first, before anything can solve the problem with the Marcon. I mean, it can be helpful for sure. But I mean, I can't say that it would cure anything.
There's a lot of crossover too with in natural medicine, especially when we're working with herbs or oils, like for example the citra drops, right? It can have, you know, both antifungal and antimicrobial properties, so you know you may be getting that multifaceted benefit from it. But like Catherine mentioned, you know, the overgrowth is probably a symptom of another problem, most likely, you know, mold and fungus inhalation.
Well, and another thing I will say, Heidi, the Citra Drops nasal spray, due to the fact that it is homeopathic, one of the reasons we really honed in on making a homeopathic nasal spray is because it can safely be used in a moldy environment to help when you can't get out, because it's not going to create like any kind of fungal resistance from frequent use, even everyday use, which is really important, especially if like the exposure is ongoing. So, but I think that wraps up the questions, unless anybody has another question we didn't get to. I'm so appreciative of your time and all of the information you shared. We will, if you can't find the links, just comment and we'll send them to you about how to find Krista. And I think that concludes the live.
Awesome. Thank you so much for having me. Thank you everybody for your questions. It was a great conversation today.
Thank you. Bye, everybody.
Bye.